Hi friends, welcome back to Coffee with Ravi. Today my post is about smoking and how to quit smoking. There are three major causes through which smoking can cause mortality or death, which includes heart disease, lung disease, and COPD. We had talked about lung disease in my previous post. Cancers are one thing, and of course heart disease. There's many potential benefits of smoking cessation. The number one aspect of it is a decrease in heart disease, and of course there's a big decrease in the number of cancers that can be associated or caused by smoking, which include colorectal cancer, kidney cancer, lung cancer, pancreatic cancer, stomach cancer. Smoking cessation or stopping smoking can help improve lung disease that's already existing. And of course, if one doesn't smoke at all, you've prevented that. There's a decreased risk of diabetes, there's a decreased risk of bone disease, there's decreased risk of disease of the gums, decreasing cataract and eye problems, and if one is having surgeries, of course, quitting smoking helps you recover faster. So there's tremendous benefits both from an individual health as well as a population health in preventing smoking. When you quit smoking, here's things that one can expect. One thing that can happen is the nicotine withdrawal syndrome, where it's more a craving or a psychological aspect of jitteriness, things like that. Weight gain can be common, as well as cough, mouth ulcers, and depression have been described as consequences of quitting smoking, but these are only short term. The long-term benefits are super big. From a standpoint of a person who wants to quit smoking, I think it's best to start discussions with the healthcare professionals, because here's what a healthcare professional can do, which I will cover in my next slide. And from a healthcare professional standpoint, I think all of us need to do a better job in really inspiring patients about the benefits of smoking cessation. From a standpoint of what you can expect from a healthcare professional, the two big aspects of it are, actually there's three big prongs of it. One is nicotine replacement product. The second one is drugs that decrease the craving. The third aspect is behavioral strategies and counseling. And of course, the fourth big strategy, I think, is providing everybody with the quit line, website, and telephone line. All of these are big strategies. Again, to repeat, it's nicotine replacement products, drugs that decrease the craving. The third thing is behavioral strategies, and the fourth thing would be the quit line resources that are available for every state. Nicotine replacement strategies, there's many different options that are available right now, which include the gum, the lozenges, the spray, the inhaler, as well as the patch. Each one of it has pluses and minuses. Essentially what we're trying to do is that we're trying to give replacement of nicotine without all the adverse effects of the tobacco and the metabolites of tobacco that actually cause the problem, so that the craving aspect is reduced. The patch is relatively stable. It provides a regular level but cannot be actually increased, whereas with gum and sprays you can actually increase it or dose increase it based on what one needs. And I'm not getting into how those can be dosed or how you can use them, because that's probably a specific conversation you need to have with your healthcare provider. The downside of the gum as well as the lozenges is the taste that sometimes patients say is not so great. And with the inhaler, there can be some irritation of the mucosa or sometimes some irritation of the lungs, especially if one has COPD, but those are minor. The medications bupropion and varenicline are both useful, but have to be used carefully in people with other psychiatric comorbidity. So therefore, that's a discussion point again to be had. Behavioral counseling is helpful, provided that's easily available and accessible. And the last thing is that the Iowa Quit Line is very helpful. They help in getting together a plan, help manage cravings, trying to identify triggers. And I have the website up on the top of the slide that will help you get to that. So in summary, The one thing that we can all do for our friends, family, and for ourselves is to quit smoking, or to encourage people to quit smoking. There's lots of benefits even if one has some ongoing disease, because it makes things better. Not to start smoking in the first place is the best benefit, so I think this can be used as an educational tool to younger people so that they don't start at a younger age. But there are resources available, and these strategies that are I've listed are helpful. They're not all of it, but they're helpful adjuncts provided we decide that we can quit smoking.